welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Well, happy Monday, everybody. It is Dr. Mitzi, your board-certified neurologist and MS specialist. I am so excited to be back with you on this first Monday of April for another episode of Brain Chat. And I am so excited about my guest. We are going to have an action-packed conversation about stem cells. Now, stem cells have always been a hot topic with MS, and we go through periods where people are talking about them a lot, then a little bit, but I get questions all the time about stem cell therapy, and I'm super excited to have an amazing expert with me, Dr. Imatola, to talk about all things stem cell therapy, and kind of, where the field is going and what we're doing in terms of stem cells. You know how we do when we start Brain Chat. Just log into the chat. Tell me where you are calling in or viewing us from. I bid you greetings from rainy and dreary Atlanta, Georgia, where it is spring, but also kind of second or third winter. So it's a little chilly, a little warm, all that good stuff. So, but I hope everybody's staying dry and staying warm. All right. So we also want to thank our sponsors. We want to thank Biogen IDEC, as well as the National MS Society, which has come on as a new sponsor for sponsoring Brain Chat. We're really excited about having some great conversations this season and about many of the things that we'll be talking about soon. All right. So I see somebody logging in from Florida. All right. Hello, Florida. We see Kentwood. I guess that's Louisiana. All right. Welcome, Louisiana. And again, just let us know where you are viewing us from. All right. So I am going to introduce our guest, Dr. Imatola. Dr. Imatola is the Vice Chair of Neurology Research. He is the Director of the MS Center and Chief of the Division of Multiple Sclerosis and Neuroimmunology. And he's an associate professor of neurology, genetics, and neuroscience at UConn Health. He is a physician scientist, a neuroimmunologist, very knowledgeable. If you are on Twitter, he is always tweeting about new articles and research and things that are going on. And his primary interest in MS is progressive MS, as well as stem cells. And he's been studying for the past 20 years. So we're very excited to have him on the show tonight. I think we're having a couple of little technical difficulties, so we'll give him a few seconds to log back in. Okay, it's frozen. Okay. All right. So we'll give him a couple of seconds to log back in for those of you watching. All right. So stem cells have really been, a very interesting topic to me because I get lots of questions about them. And many of my patients are wondering, Dr. Mitzi, should I get stem cell therapy? Should I go out of the country to get stem cell therapy? And so there's been a lot of advances in research, concerning different types of stem cell procedures, how those things are administered, and kind of where to get access. So I want to get into a good discussion about stem cells. And first, I want people to understand that this type of research has been going on for some time. So for many decades, actually, there's been research focused on stem cell transplants and the use of stem cells in multiple sclerosis. So it's really not a new thing. But certainly, there are many different types of procedures that are out there. And I want people to be aware of the different types of procedures and kind of, what the pros and the cons are. So I am going to bring Dr. Imatola up. Awesome. Welcome, Dr. Imatola.
Hey, how are you? I'm so sorry.
That's okay.
Some connection problems here.
That's okay. It's raining. It's a manic Monday. I definitely understand the internet is acting up. But so I was just kind of giving an intro to our Brain Chat audience and talking a little bit about stem cells, which, stem cell therapy is not a new concept with MS, although the research has evolved over time. So, first, I want you to tell us how you got involved in doing research in stem cells. And then I want to say, what are stem cells, right? Are all stem cells created equal? Is a stem cell, or are there different types?
Yeah, well, thank you for the invitation. So I am a neurologist. I'm a board certified neurologist with a specialization in neuroimmunology, and also I'm a stem cell biologist. So I spent many years training in both, and so I was born outside the United States, and then came here to do stem cell biologist in Boston, and then I retrained in neurology again, and I became a neuroimmunologist. So I'm here now at the University of Connecticut, where I am the director of the MS Center, and I run a lab that works in the stem cells applied to MS. So I've been in the field for about 15, 20 years.
Hmm.
Five of them as a trainee, and then actually working as a junior faculty. And as you pointed out, stem cells are basically cells that are kind of very primitive but have a great potential. So
Hmm.
we all are made from stem cells. So we have the critical characteristic of a stem cell is the ability to produce copies of themselves, and also the ability to generate all the cells in the organism. So
Mm.
the bone, the blood, the skin, they all come from this very potent cells. And as we go and grow, then the cells start to becoming more restricted, and then we call them progenitors. So progenitors are stem cells, but they have a very narrow potential for differentiation. Let me give you an example. So if you have cells from the brain, progenitors from the brain, they will make brain cells,
Hmm.
but they won't make any blood cells. If you have blood stem cells, they will make only blood cells, but not brain cells, that
Hmm.
because they have this very restricted ability. And as you pointed out, this field is about 100 years old, and but over the last 30 years, we have a renewed interest because of a series of inventions and discoveries, and that's why now we're enjoying this time. So stem cell is research for
Hmm.
the most part,
Hmm.
not there's not therapies. There is a specific therapy that we'll talk about it, but the most important part is the research. And what is important is the potential, because we think that either studying stem cells for diagnostic purposes, or for therapeutics, or for understanding the disease, has a lot of potential for human disorders. So yeah,
Hmm.
so that's kind of the spectrum of what we call stem cells at this moment.
So that's one of the best explanations, obviously, because you're an expert, right? But so we have stem cells that are, cells that can basically become any type of cells, right? So those are really
Mhm.
powerful cells. And then within different parts of our bodies, we have kind of powerful, but maybe a little less powerful stem cells that only make certain types of tissues.
Yep,
So we have
exactly.
some that'll make anything, and then some that'll make specific types of things.
Yes.
So I think that that's important. Now let's talk about what types of procedures there are, right? So, there are, one of the things I, was reading about some research maybe in the past, 5 years or so, we were trying to figure out where to put the stem cells, what type of stem cells to use. So let's talk about just kind of generally some of the different types of stem cell procedures, and then we'll go into which ones have been mostly studied in regards to MS.
Yeah, great. So the as I mentioned, about 2000, we started to 2003 actually, when I was in Boston in the Harvard system, we started to study whether or not cells from the brain in mouse models
Mm-hmm.
it could cure MS, right? So about 2003, there were about probably 2 or 3 papers suggesting that injection of these neural progenitors, stem cells from the brain, were able to ameliorate the disease process.
Mm-hmm.
So that was injection either in the brain
Mm-hmm.
or injections in the veins in those animals. So,
Mm-hmm.
but these were very restricted from the brain type of cells.
Mm-hmm.
There is also the idea that since we have bone marrow stem cells that produce the T cells and the other cells that are important for the disease, MS. MS is an immunological cell. So you can actually take the cells, kind of erase all the bad cells,
Mm-hmm.
and then put new cells. And these cells are naive. They don't know that they are able to produce a disease. So that's another procedure. So we call it bone marrow transplant, or
Mm-hmm.
in other words, it's called adult hematopoietic cell transplantation,
Mm-hmm.
or HSCT. So this is a different procedure. So as I mentioned, there is a big spectrum in research, some of which are happening in mouse, but there are also these procedures are now, some are in the clinic right now that are more evolved, and they are more effective, if you will.
Mm-hmm.
And so that's the spectrum, right? So we can talk about what is clinically demonstrated to be effective, and
Mm-hmm.
what is in the pipeline, what
Mm-hmm.
potentially will be of relevance. So the idea in the brain is that when you have MS, you have damage in the brain,
Mm-hmm.
but this damage is caused by immune cells. So you can have two things. You can choose to erase all the immune cells that are bad, replace them with your own cells that are naive. So basically, we tell people that we're going to give you a younger version of your immune system. So
Oh,
immune system.
don't we all want to be younger?
So the immune system in MS, we think that when you grow up and it starts to getting a little difficult to manage, and then the immune system, because of either your immune system genes or your exposure, things like that, the immune system start getting like a very unruly and sees the body like a target. So that's the concept of autoimmunity. Auto
Mm-hmm.
means me, or self. Immunity means damage to the immune system. So
Mm-hmm.
yeah, so we have that, and then we have the brain type of cells, right? And in the brain cells, now we have new data, in clinical trials, that taking some brain cells, you can actually show that they can be effective.
Mm-hmm.
I'm sorry, they can be safe, and there are some hints of effectiveness that promising, but it's nothing that is already ready for prime time.
Yeah. So this is really fascinating, right? So, it sounds like, especially with hematopoietic stem cell transplant or HSCT, it's really kind of like maybe hitting the reset button potentially, right? So, kind of wiping out the bad stuff and then resetting so that hopefully when we put in those new cells, although they're your cells, that they won't kind of begin to attack that person's brain and spine again and lead to more symptoms of MS. Now, let's talk about what types of stem cell treatments have been studied with MS, right? So you talked about, directly maybe putting cells in the brain area or in the spinal fluid. You talked about using the bone marrow. More recently, I've seen lots of procedures, particularly online. My patients will ask me about procedures that are, like adipose tissue transplant, right? Where they may take stem cells from fat tissue and then go through some process and give those cells back via IV and intranasally, a bunch of different ways. So, which types of procedures have been studied and have shown some results, particularly
Yeah.
for multiple sclerosis?
Well, this is a great question, because the key word that I want the audience to kind of learn is the word rigor. Every time we do a clinical trial or things like that, we need to go through a very rigorous process,
Mhm.
right? And so that's actually science. So
Mhm.
it's through the clinical trial, and there are some procedures that are are not going through clinical trials,
Mhm.
that are now being offered by clinics
Mhm.
with this concept that there is regenerative medicine and these are stem cells in your fat tissue, but they are not rigorously studied. I
Mhm.
mean, through as you know very well, every time you want to do something with humans and put anything, a new experimental drug, you have to go through a process that
Right.
contains several stages: phase one, phase two, phase three. That is just basically to show that there is a complicated step ladder that you have to go through.
Right.
So, what has been demonstrated to be of use for patients is the bone marrow or adult hematopoietic stem cell transplantation.
Mhm.
And that's actually very promising, and there are many places around the world that uh, have introduced that in patients with MS. And the key for that is this concept of resetting
Mhm.
the immune system, because if I have MS, I will have my immune system kind of attacking my own cells. So we can wipe those cells and reintroduce your own cells. And as I mentioned, these cells are going to be this your a copy of yourself, and they won't be rejected. That's one thing, and they will produce a new immune system that is going to be less offensive to you.
Mhm.
So the important aspect of this type of research is that it has gone through several trials.
Right.
So historically, what entails is a very rigorous process. Obviously, we need to choose the right type of patient,
Mhm.
and then the patient has to be informed about what is going to happen. First of all, we have to get rid of all your immune cells
Right.
with a process that is very, complicated, a little toxic for, in general, because, we give medications to actually eradicate all the immune cells, but immediately we'll replace it with a version of these new cells. So that
Mhm.
that process is called myeloablation, that
Mhm.
where you get rid of all the cells, and then you will probably introduce your own cells that you have isolated prior to it. So for
Mhm.
that process to happen, that now has gone through research into already very powerful clinical trials.
Right.
In the last 10 years, we have several clinical trials. One famous clinical trial was called the HOLT trial,
Mhm.
the hematopoietic trial that showed that indeed these cells were able to, this treatment was able to actually modulate the disease. And remember one thing that is interesting: we're not um, changing the brain. We're
Mhm.
actually taking all the immune system and having a new immune system. So
Right.
that means that the effectiveness is associated with the modulation of the immune system. There is a
Mhm.
complete new immune system. So that's
Right.
one thing. And then right now, we have a very big trial in the United States, about 20 sites in the
Mhm.
United States and in Europe. It's called the BEAT MS. The
Mhm.
BEAT MS is the best available treatment against hematopoietic bone marrow transplantation. So, and this trial is done with the goal to
Mhm.
demonstrate that hematopoietic stem cell transplantation is equal or superior than
Mhm.
any other medication that you're getting at this moment. So
Wow.
when that's happening, when that's concluded, I mean, I think that they are still recruiting. And as I said, there are 20 sites in the United States.
Mhm.
And when the interim report comes, that probably is going to be 3 years from now,
Mhm.
then that will give a confirmation to what we already know. So we already know
Right.
by other trials done in Europe, in Canada,
Mhm.
specifically in Canada, there are very important investigators in this, suggesting that indeed it is very powerful.
Yeah.
This has been so overwhelming positively that the National Multiple Sclerosis Society had issued a guideline
Mhm.
about probably a year ago, reviewing all the literature there, right? So the guidelines of the MS Society, that were written by experts in the field, and the guideline basically support that patients with MS, under certain characteristics, they may seek this type of treatment. The
Yeah.
problem is the treatment is not paid by insurance
Right.
because the insurance doesn't recognize the treatment approved by anyone,
Right.
because the data is still ongoing.
It's still ongoing.
In other countries is in Europe, in the Netherlands, in Canada, and things like that. It's actually more advanced, and
Right.
people are getting this trap. Now, I have to say this, that this is the rigorous trials, right?
Mm-hmm.
But in the same time, there is this new cadre of clinics that are emerging, taking advantage of patients, saying, well, we have some stem cells here,
Mm-hmm.
you can get it, and you can get a tummy tuck. We get the fat cells, we go and put it through a mesh, and
Mm-hmm.
then we call it fraction, a stroma fraction,
Mm-hmm.
that in theory contains stem cells, but it's not rigorous like the other trial. That the other
Right.
trial, you need to demonstrate that
Mm-hmm.
what you're getting at these are the real stem cells from
Yeah.
from the patient. So
Yeah.
in conclusion from this part, we have very rigorous trials
Mm-hmm.
and not so rigorous trials. So and the patients, they don't know the difference, because
Right.
they have to have doctors that can explain the
Right.
difference. And one of the important things is that when you don't know, you can take advantage of. They can take advantage of you, and
Right.
then you spend a lot of money. You spend twenty
A
thousand
lot of
dollars or
money.
something that
A
is
lot
not
of
going to work.
money. Yeah. So I'm so glad you brought that up, because this is something that, I do a lot of counseling with my patients about. Number one, it's very important to research and understand what, procedure people are talking about when they're offering different stem cells procedures. So first of all stem cell procedures are not the same thing, right? So just because it says stem cells doesn't mean that it is the procedure that has been kind of studied or well studied with multiple sclerosis. I always recommend everybody consult their doctor, have a good conversation with them, before you have any kind of procedure that is supposed to or not supposed to help your MS, or, as additionally to treatment with MS. Now, I think one of the difficult things is that sometimes when we're going through that randomized and rigorous testing process, it can mean a very long time between the time we realize something is effective and the time that we can offer it to our patients. So certainly that's something that, my patients have expressed frustration about. It's like, well, okay, well, if we know this works, then why can't we use it, or why can't we access this type of procedure? But before we go into kind of how people access through studies, I want to back up just a little bit and talk a little bit more about the procedure itself. So again, although we're saying, it is definitely very promising, it is not a simple, easy procedure where you just go get some stem cells and come back home. Okay. So let's talk about this procedure. You usually have to get some type of chemotherapy type drug, so we're really, when we are resetting that immune system, we are really wiping out the immune system that's there. So when we're
Yeah,
talking about immunosuppression, many times people get concerned about their immune system being suppressed with our MS drugs, but we're not really suppressing the immune system to the extent that is
yeah,
suppressed with chemotherapy. But when you get stem cell, we're suppressing, like we trying to wipe it out and start over, right? So there are potential side effects and consequences to those types of procedures. So let's get into a little bit more detail about what it entails, right? Because someone would
yeah,
literally have to take time off of work. I mean, you're going to be out of commission for a little bit of time to get a
yeah.
procedure like that done. So
So
give us a little bit more detail about it.
so the first of all, just to give a context of this. So bone marrow transplant is done in 92 countries around the world.
Mm-hmm.
So it's something that has been there for a long time. We know,
Mm-hmm.
and in the majority of cases, is done in the context of cancer,
Right.
right? So I mean that the procedure, all the so you need to appreciate as a patient that you need a team.
Right.
In the United States, there are places that are accredited to carry out this procedure. So there is an accreditation process. There is a formal place where you can actually look into these places. And so it's not like you're going to find the clinic down the road that
Right.
it has to be accredited through the Federation of Cellular Therapies in the United States. And in order to do the procedure, you have to have the demonstration that you have a team.
Mm-hmm.
So you need a team of the hematologist, the guy that is going to wipe out your immune system, and you have to have a team of neurologists and
Mm-hmm.
nurses.
Right.
So so what happens is that the patient is first is the patient is consult whether or not the patient meets the criteria.
Right.
So in theory, in the United States right now, if a patient has aggressive MS and less than 50 years old and has actually failed one or two of the uh, top-notch medications of MS, that patient, according to the guidelines of the MS Society, may be a patient that is actually, a candidate
For
for
stem
that.
cell therapy. Mm-hmm.
Right, number one. And then after that, you discuss with the patient and you discuss with the team. They explain the actual procedure. First is going to be the collection of the immune cells from your body
Mm-hmm.
because we want these very rare cells. So if you have a million cells that we take, maybe 10 will be the cells that are actually the true bone marrow stem cells. So we need to get all your cells, and then these cells are actually captured with a special procedure. They have a very interesting receptor. We call it flag. Imagine that you have a cell and you have a red flag,
Mm-hmm.
and that red flag has a very specific name. In the name of these cells will be the CD34 molecule. And then we capture only the cells that have that flag, and then
Mm.
we set it aside. One interesting thing is that those cells don't know anything about MS,
Mm.
right? Is the progeny of those cells that
Mm.
know the disease.
So
So
it's
these
their
cells are
children or
completely
grandchildren that.
exactly. So
Okay.
it's like
So those cells don't know anything about the MS. They're like, we
no,
don't even know what that
don't
is.
know anything, and then you collect those cells,
Mm-hmm.
you take them apart, and then you go to the next step, right?
So how do they
Even
collect the cells?
so they have to take the patient and they take a vein and then they collect the cells little by little
Mm-hmm.
in a procedure that it takes several hours. And even for that particular procedure, you have to stimulate your body
Mm.
to make more cells. So that you
Gotcha.
have to go through some treatment so you can actually have more bone marrow stem cells. So
Mm-hmm.
that's number one. And then after that, you have to actually nuke the immune system, right? That's where the regimen that I am talking about. Now, one thing that is interesting is that many in our field feel very confident about the side effects and about the mortality. It is true, we always look at the movies when somebody's getting chemo and it's like, with mask and it's very special. Yeah, we have to be very careful, but the mortality has gone down from 1%, now it's about 0.1%. And
Mm-hmm.
we need to explain that to the patients,
Right.
right? Because it is a shared decision process.
Absolutely.
As in any other decision that we made about these diseases, patient needs to be informed
Mm-hmm.
and the doctor needs to tell everything, put it on the table, and then the patient will make the decision with the doctor, right?
Mm-hmm.
So after that, then the patient goes into a very rigorous regimen to ablate the whole immune system, and here's where you can have side effects because
Right.
you're already in a state of real immunosuppression. So
Mm-hmm.
yeah, you alluded to that, right? So people say, well, I'm immunosuppressed because I'm in XYZ medication. So really, no, you're immunomodulated because it's
Right.
just a little part of the immune system. But in this case, you're gonna get all your immune system completely knocked down
Right.
because we want to get rid of the cells that produce MS.
Right.
And then when this is accomplished, one of the most important things is to make sure that you don't get infected,
Mm-hmm.
right? Because that's an important thing. If you don't have a powerful immune system at that moment, you can get, infected, and we don't want that. And then after that, then you get,
So you usually
uh,
stay in the hospital for a period of time.
yes, You stay
Right.
in
So
the
after the
hospital.
procedure, after we wipe out, it's not like an outpatient where we give
No,
you
this is
medicine. Like once you get wiped out, you got to stay there for a while, and everybody that visits you has to, we call it neutropenic precautions, wear,
yep,
gloves and all that stuff, so there's a period of time where you have to stay in the hospital, until that immune system can be given back to you.
yeah. And then after that, you get your these cells with a typical marker back,
Hmm.
and these cells start to get integrated, and then they generate a new immune system, and that takes about two, or total is about 2 months
Hmm.
at minimum, and depends of the complications if there's anything. So I think that the most important challenge right now is that if you ask anybody that is doing bone marrow transplantation in the United States, um, they are not familiar with MS patients.
Hmm.
And here's where the patients and the doctors can work together. So number one, many neurologists, they don't know that this exists. And thanks to your program, they will know. And many
Hmm.
patients doesn't know either, right? So you can go to the MS Society guidelines
Hmm.
and print it and say, hey, what about this,
Hmm.
right? Because we're not saying that we cannot contemplate the conversation, but the problem is that we have so many challenges to the implementation at this moment, because the insurance companies are going to have. It's kind of interesting because it's a challenge, but if you take a look at the data, so if you have bone marrow transplant or adult hematopoietic cell transplantation, you get remission for 3 years.
Hmm.
So if you put that in numbers, right, it's about a a savings of about 60% of the savings that you invest in the
A
typical
medication.
medication with MS.
Hmm.
Because in medication for MS costs $10 every year, you get $30.
Hmm.
The bone marrow transplant can cost $15,
Right.
and that gives you 3 years of savings. So
Years of
from the
effect.
from the from the insurance perspective, they need to be educated, because
Right.
this actually is cost effective and it's cost saving. But
Right.
again, we need to be also rigorous to say that right now it's not a procedure that is for everybody, and
Right.
because the balance between side effects, potential side effects, and the
Hmm.
benefits.
So we talked a little bit about some of the side effects. So again, brain chat is all about education. So I want people to be aware and have good, sound knowledge, if they're making decisions, and to make sure that they're taking this information back to their doctors to discuss about their treatment plan. So, it sounds like it is a rigorous procedure. We talked about, the fact that during that period when we ablate or wipe out the old immune system or the current immune system, so to speak, there can be a risk of infection. We talked a little bit about, some of the risk of mortality or death. A lot of that has changed, I think, primarily because the types of medicines that we use to wipe out the immune system have changed over time. As we have gleaned a lot from our oncology colleagues, and as the treatment regimens have changed, they have a little bit better side effect profiles. Are there any other side effects potentially of stem cell therapy aside from infection and potential mortality if there are complications with the procedure? Are there any other complications that are
Yeah,
common that could happen?
uh, yeah. Well, I mean, the in general, I mean, as I mentioned, I mean, when you do it rigorously, yeah. So mostly infection. There is always a risk of changes in the immune system, relapses,
Hmm.
because I mean, in the beginning when you are trying to get more bone marrow stem cells, there is always this possibility that you will activate the immune system. But I mean, that's why you need a team, right? So
Hmm.
remember that for bone marrow transplant, for hematopoietic cell transplantation, you need two teams: the hematologist and the neurologist, and each
Hmm.
of them, they need three more people to work with.
Right.
Obviously, if you were to receive any other non-rigorous stem cell transplantation or purported stem cell transplant, there are many. So we did a study about 2 years ago where we looked into the complications of what others were calling stem cells. So we call that
Hmm.
stem cell tourism, meaning that people go to other countries that even they can do this procedure because, as I mentioned, bone marrow transplantation has been around for many years and it's
Hmm.
done in 92 countries. So
Right.
imagine that you go to Juarez or Mexico to get this. I mean, even if they are hematologists, you don't know what they are doing. I mean, you don't
Right.
know. And you saw the kind of tragic story about 2 weeks ago of a family crossing the border and getting into troubles because they were looking for some sort of transplant or some
Hmm.
sort of procedure there. So the question is, when you go there, you don't know what you're getting, you
Right.
know, and then they will tell you, well, we're doing this and that, but in reality, maybe that is not very effective. So there are many strategies done right now
Hmm.
in many countries
Hmm.
where they don't give you a real transplantation.
Yeah.
They don't get rid of your cells and they don't go all the way because
Hmm.
to go all the way, you need a big team of
You need
people
a
to help you
team.
out.
Yeah, so
Yeah,
accountability is important, because, in my experience, I have had patients who have gone, or I've had people who've come to me after they've gone out of the country and had some type of procedure, and they may have complications, and that doctor is like, well, I did what I'm going to do. Go back to your other doctor, right? So it's
yeah,
important again when you're thinking about things that could potentially have these significant consequences, that there's some accountability, right? That you're within a system that can be held accountable if there are issues, or that have those teams that can follow you up if there are problems, or if there are things that you come across down the line. So that's a really, really important point.
yeah. And
Go ahead. Go
this
ahead.
is important because I'm sorry, it's important because you know, if you get into troubles in other countries, or we have seen this a lot. So
Right.
infections is a very important one. There are trauma associated with the procedure because in many places they will inject you in your spine some cells. And
Mm-hmm.
finally, one of the most significant one is a tumor originated from the transplant
Mm-hmm.
that you're being given. So in that paper that I am alluding to, we try to provide a very simple infographics to patients
Mm-hmm.
so they can actually use it when they talk
Yeah.
to the doctors. And we translate that into many, many languages because it's not a problem only here, it's a problem around the world. I mean, there
Yeah.
are these clinics that are very exploiting patients.
Yeah. Well, we would love to
Hope,
get access to that and, make sure our viewers have access to it. So
sure.
as we're coming, so this has been a great listen. I'm totally enthralled in our conversation. But as we're coming kind of a little bit closer toward the end of our time, I do want to talk about how people do get access, right? So again, we talked about in other countries. I just was on a call with one of our colleagues from the UK, and hematopoietic stem cell transplant is available if people have failed one therapy. So how does someone find out if they are even a candidate, or find out where it's being done? How do people find out that information, particularly for
Yeah,
those who may not have access to an MS specialty center, and who may be trying to get that information to talk to their general neurologist about it?
yeah. So the NMAC of the MS Society, the National Medical Advisory Board, set up guidelines for Americans,
Mhm.
and they are available online. Is MS Society and stem cells, and the guidelines are very clear, are enunciated very clearly. There are some infographics that are there. The problem right now is implementation across the country
Mhm.
because right now the access or how do you get to therapy is only done through a clinical trial
Okay.
because the issue of the insurance. So we think that if patients we can convince the insurance company to start paying for this. I mean, many patients will have it from the institutions. I mean, there are institutions that are ready to go.
Mhm.
In addition, there is a need for be frank about the number of institutions that are capable at this moment to offer the transplantation. So because there are 20 sites in the United States that are doing the BMS trial and others.
Mm-hmm.
These places are going to be the first one to be more trusted to
Mm-hmm.
offer the bone marrow, transplantation, if you will. So I think that to be clear and deliberate and declarative here, I think that everything started with the guidelines that are now that are very trusted by the MS Society, and then
Mm-hmm.
after that, in the guidelines there is a know-how to do the description of how to find the places, and
Mm-hmm.
then that will be the next step.
Okay.
But yeah, so in general, will be a place that right now is doing the clinical trial for hematopoietic stem cell transplantation.
Okay. So 20 places across the US are currently, a part of the Beat MS trial. And, the guidelines on the MS Society website can tell people how to find out about which sites are doing stem cell transplant. So I think this has been a really interesting and amazing conversation. I really spend a lot of time educating my patients about stem cell. I certainly try to discourage people from going off to here or there. We try to go through the sites that are doing them. I know Cleveland Clinic is heading up. That is Jeff Cohen at Cleveland Clinic is heading up that trial, at Mayo Clinic. So I know that there are a lot of places that are participating in that trial. I did have a couple of questions here in the chat. So one, which I see very commonly, is stem cell a cure? Do you think this would be the cure for MS?
Well, that's a $1 million question.
I know.
So let me put it, because I just finished a meeting with somebody about what a cure means, right?
Right.
So I mean, and people have done this in several ways. So I mean, a cure will means stopping the disease, right,
Hmm.
or progression. So no more progression will be a definition of cure. Not having MS, if you can from the get go, that will be a cure.
Hmm.
So, um, if I talk to my patients and I say, well, I have now something that can help MS to stop it, they will say, but what about me? I have 30 years of MS.
Hmm.
This is not a cure for me. So a cure might have different
It's
connotations. So
relative.
for me is all of the above, right? So is avoiding progression, stopping MS as its track, because we have 1 million people in the United States
Hmm.
with MS, and they are in different stages of their life,
Right.
and then they have different goals of care and treatment. So
Hmm.
I would say that in some patients, this could be a
It could
cure,
be. Hmm.
right? Because I mean, I want the audience to be aware about this. We are our best advocate. We need to
Absolutely.
take this conversation back to the patient. Well, I'm not a patient with MS, but you know what I'm saying. Like
Hmm.
we need to empower our patients
Right.
because they are the ones that need to drive this.
Right.
So the idea is that as a community, patients, doctor, Mitzi, and others, we need to create this culture and this community of helping each other, right? So I mean, do you have a family member with MS?
Hmm.
Yes. And are you smoking? Yes. So that this person, just by these two
Has an
things,
increased risk.
is increased rates, right?
Hmm.
So we need to educate people, and
Right.
so I think that there is a lot to do with the community, and unfortunately, um, historically, this has been a disease for certain populations,
Right.
but we know that that's not the case. That a lot of
Yeah.
people have MS. So the cure for MS is the act of identifying the disease early, treat appropriately, diagnose appropriately, and I think that we can do that together.
Yeah.
I mean, you can argue that we need a fancy drug. Yes, we do.
Hmm.
When that drug comes, yeah, by all means, right? So many patients tell me, "Am I going to walk again?" And I have to answer in different ways depending on the patient.
Right.
But if I have a patient that is 20 years now and he has the worst MS ever, I know that I can do something unique for that patient. So in
Yeah.
addition to have a good doctor and a good team, I'm sorry that I'm taking your time, but I think
No,
this
you're
is
good. You're
important.
good. You're saying all the right things. This is I'm eating this up. This is what I
So
love for people
for
to
the
hear.
audience, right? I mean, you know NASCAR, right? So
Mhm.
every time a NASCAR car stop at the pit stop, there are 25 people jumping on the car.
Mhm.
So guess what? You're the driver.
Right. You are
As
the
a
driver of the
patient,
car.
you are the driver of the
We're
car.
just
You
trying to
are
change the tires and tune it up a little bit so
exactly.
you can keep going around.
We, we are the people that are going to help you to get where you want to go. So
I love it.
put that into your head, right? That
Mhm.
that you need to be empowered to help yourself and others. So yes, a cure is not elusive.
Right.
Um, if we keep working together, obviously for the future patients,
We'll get there.
perhaps we have a
Yeah.
cure. And by the
Yeah.
way, historically, I tell, and this is just to remind our patients, I don't want people with MS treated like it's 1983.
Right.
I want
We've
people
come a
to be
long
treated
way.
like it's
Absolutely.
2023. And by the
Absolutely.
way, with all due respect, there are patients treated like in 1983,
Absolutely.
not because of your fault, it's
Right.
because of the circumstances. So we need to
Yeah.
be education to be educated.
All of our
And when I say
colleagues.
educated, I don't mean in the pejorative way that you don't
Mhm.
have education. That's not the way.
Mhm.
Information. It's all about
Updated.
information.
People need to be
Yeah,
updated.
updated.
Mhm.
Yeah. So
Absolutely.
I think that what you're doing is incredible, and
Thank
thank you
you.
for having me.
Absolutely. And one more quick question because I had two people in the chat. What about our patients who are over the age of 55? So, I had a couple people, we talked about stem cell people under the age of 50. Obviously, it's a very rigorous procedure. So, if you're a little bit younger, you may be able to tolerate it better. Also, we have to think about the immune system aging, that process called immunosenescence. But many of the things that we're doing are kind of leaving out our folks over
Yeah,
the age of 55. And let's be clear,
exactly.
55 is not old. So it's
Yeah.
not
So
old.
the guidelines, guidelines are guidelines, right? So
Yeah.
they are not like the law.
Hmm.
So I think that we have to personalize and take case by case,
Hmm.
because unfortunately there are people that are 55 and they are very sick, not from MS, but from the body.
Right.
I mean, like
Other
if you,
conditions.
I mean, yeah, I mean, if you have diabetes, hypertension, and are you a good candidate? Well, you can have 55 years old, but we will have troubles. We will have more risk when
Hmm.
we take all the immune system down, and so it's a relative marker. I mean, there are people that are 65 and they look like 55, right?
Right.
Because I mean, and unfortunately, our patients with MS, they might age faster because all the other things that are happening. So
Hmm.
having a healthy lifestyle, prevention is important. Please don't
Absolutely.
smoke. Please don't smoke if you have
Yeah.
MS. Take care of your hypertension,
Absolutely.
and take care of your diabetes, because MS plus. So that this is a concept that we're putting out there for our African American folks and also our Hispanics folks. MS plus is bad.
Right.
MS plus hypertension.
Hmm.
MS plus diabetes.
Right.
MS plus something. So it's bad
Right.
news, and we need to care for you
Yeah.
guys.
The MS is enough. We don't need it plus anything else. So
Yeah.
this has been, listen, I love chatting with you. This has been an amazing
Likewise.
conversation. It's so informative. Thank you so much for the way you've explained everything. For our listeners, I think that people will go away from this. My hope is that you go away from this with a better understanding about stem cell therapy, that it sparks some conversation to talk to your doctors, that you don't necessarily go to every place that's open that says stem cells and wants to charge you, $10,000 a year, but certainly that you have more, that you're armed and empowered to get that information, take it back to your team to see if this is something that's appropriate for you. And I'm just very excited about where our field has come. We've come a very long way, but we certainly still got a little bit of a ways to go. So thank you
Yep.
so much for this amazing conversation, as always. And thank you all for Brain Chat. Thank you
Yep.
to for our sponsors. Thank you to Biogen IDEC and National MS Society. And I will see you guys again in 2 weeks. Have a great one.
Thank you very much. Bye-bye.